Here at MedRock Pharmacy, we compound a few different medications that can be used to treat hair loss. Alopecia is a medical term for hair loss from the scalp or body and can affect both men and women, although it is more common in men. It can be hereditary, but it can also result from hormonal changes, medical conditions, or be a normal part of aging. There are several ingredients we use to treat the causes and symptoms of hair loss. To identify which ingredients are in your compound, you can look on your medication label. The ingredients included will be abbreviated below the compound name. We will go through the ingredients in alphabetical order. The first ingredient is Bimatoprost. It can be identified on your medication label with the abbreviation BIMA. Bimatoprost was originally an ophthalmic drug used to reduce high pressure in the eyes when a side effect of increased eyelash growth was discovered. Bimatoprost is shown to increase hair synthesis in the scalp hair follicles. It helps with the length, growth, and darkness, along with strengthening of the base of the hair follicle when it's in an anagen phase or growth phase. Clobetasol is a topical corticosteroid and can be identified on your medication label with the abbreviation CLB. Topical corticosteroids are known to be effective in the treatment of alopecia areata by reducing inflammation and suppressing the immune system to promote hair regrowth. Studies have shown that clobetasol is effective in inducing hair regrowth in patients with alopecia areata. The next ingredient is cyclosporine, and it can be identified on your medication label with the abbreviation CYC. Cyclosporine is an immunosuppressive drug that has commonly been used orally to reduce organ transplant rejection, but a side effect was discovered related to hair loss. Studies have shown that cyclosporine is capable of inducing regrowth of hair when applied topically. It works by reducing the SFRP1 protein in the body that inhibits the growth of hair follicles. Now let's talk about estradiol. It can be identified on your medication label with the abbreviation EST2. While estrogen levels are high, women have full, thick hair. But when these levels drop, such as after pregnancy or during and after menopause, a woman's hair can thin or develop balding patches. Estradiol is a hormone that can help keep the hair in the growing or anagen phase, helping the hair stay on your head longer and grow faster. The next ingredient we will talk about is Finasteride, which can be identified on your medication label with the abbreviation FINA. Female and male pattern alopecia can occur when patients have high levels of dihydrotestosterone, or DHT. DHT is derived from testosterone, a hormone present in both men and women. Finasteride works by blocking the conversion of testosterone to DHT, which will promote scalp hair growth and prevent further hair loss with little to no systemic effects typically associated with oral finasteride. Ketoconazole can be identified on your medication label with the abbreviation KET. Ketoconazole is an antifungal and anti-inflammatory drug commonly used to treat seborrheic dermatitis and dandruff. On top of that, studies have shown it can be effective in stimulating hair regrowth and fighting the inflammation associated with androgenic alopecia. Minoxidil belongs to a class of drugs known as vasodilators and can be identified on your medication label with the abbreviation MIX. Topical minoxidil is used to stimulate hair growth in adult men and women. It is speculated that by widening blood vessels and opening potassium channels, topical vasodilators allow more oxygen, blood, and nutrients into the hair follicle. This can also cause follicles in the telogen phase or resting phase to shed and be replaced by new, thicker hairs in the anagen phase or growth phase. Hair regrowth usually occurs after the medicine has been used for several months and lasts if the medicine continues to be used. Initially, some patients may experience some hair loss. These are weak hairs that were about to fall out anyway. Some recent studies have shown hair regrowth with the use of low-dose minoxidil orally. The next ingredient we're going to discuss is spironolactone, which can be identified on your medication label with the abbreviation SPIR. Spironolactone acts as an anti-androgen in two ways. First, it slows down the production of androgens in the adrenal glands and ovaries. Second, spironolactone blocks the action of androgens in part by preventing dihydrotestosterone, or DHT, from binding to its androgenetic receptor. By applying spironolactone topically, we avoid the systemic effects associated with the oral medication. Spironolactone has an unpleasant scent. Tofacitinib is in a class of medication known as Janus kinase or JAK inhibitors. It can be identified on your medication label as TOFA. Tofacitinib has been approved by the United States Food and Drug Administration for the treatment of rheumatoid arthritis, psoriatic arthritis, and ulcerative colitis. An increasing number of studies have demonstrated the efficacy of tofacitinib in the treatment of alopecia areata and alopecia totalis. Treatment duration in these studies range from 2 to 18 months. Durability is short, with shedding occurring at a mean of 8.5 weeks after discontinuation. Less is known about extended tofacitinib administration. Tretinoin, a vitamin A derivative, is in a class of medications called retinoids. It can be identified on your medication label with the abbreviation TRT. Studies have shown tretinoin can be an effective complement when prescribed with other medications to treat hair loss. One study cites it has been shown to increase the rate of hair growth, prolong the growing phase of the hair cycle, and works well with minoxidil to produce more dense hair regrowth from regressing follicles. Tretinoin is known to increase the absorption of minoxidil and therefore enhance the response of hair growth while using minoxidil. A very low dose of tretinoin is usually used for hair products, but tretinoin can still cause skin irritation and redness. The last ingredient we'll go over is triamcinolone. Triamcinolone is a topical corticosteroid and can be identified on your medication label with the abbreviation TRIAM. Steroids are thought to reduce the inflammation around the hair follicle and are usually prescribed in combination with other medications to treat hair loss. Feel free to contact us with any questions you have. Your doctor might formulate a compound with different ingredients. If you see an abbreviation that we did not mention in the video, feel free to call us at 1-833-MEDROCK. Thank you so much from the team at MedRock Pharmacy.